procedure I'd like to go over with you is oral temperature. Now, we're not talking about anything hard. I know when you're looking at the book, it looks like it's a lot of steps, but you're just gonna get the thermometer, put on the covering, wait for it to beep, and write it down. But you go over oral temperature, do your initial steps. So ask your nurse for a report, ask about the resident's needs, abilities, and limitations, knock on the door, wait for permission to enter, call them by the name they prefer, identify yourself by name and title, and explain what you're gonna do. Find and gather your supplies. So for this procedure, I'm gonna need my thermometer. I'm gonna close the curtain drapes and doors. I'm gonna wash my hands, wear gloves as needed, and use good body mechanics. So before taking an oral temperature, there's 4 things we need to check. We need to make sure they are not confused, unconscious, disoriented, or wearing oxygen. If a resident is confused or disoriented, they're probably gonna try to chew on the thermometer or something worse. If they're on oxygen, that's gonna make the temperature very cool, and if they're unconscious, they can't close their mouth. So once you've got your thermometer, depending on the kind of thermometer your facility uses, this is the one that we have, we're gonna pull out the probe, we're gonna push down and put the probe covering on. So you just push down till it clicks. Place it under their tongue, off to one side, press the button to start it, and wait for it to beep. Once the thermometer beeps, write down the temperature. For this thermometer, we just push a button and that expels the probe. And then we place it back inside the thermometer. Make sure you report any unusual findings to your nurse. Normal temperature range for the mouth, 97.6 to 99.6. Thanks for watching.